Well, hello. This is the next installment of Physical Activity Quick Plays. Welcome, welcome, welcome. If you haven't been here before, my name is Lisa Workman. I'm a clinical exercise physiologist, kinesiologist, yoga therapist, all about helping you become a little bit more physically active in your life. And today's lesson is all about chronic health conditions and the power that exercise can have with the prevention and management of those health conditions. And so, thought today I would go through what we know. So, what we know? Well, we know that it's no longer any doubt that there is a need for physical activity and exercise with individuals with chronic disease. We know that it's mostly safe and that we can get people moving their bodies even if they have a health condition. So, how does this work with exercise? What does this actually mean? Well, regularly practice exercise has a positive influence on the risk factors associated with many chronic health conditions. And so, today, let's just briefly jump in to see what actual chronic conditions does my exercise influence? And there are a lot. So, hold tight. Here we go. Let's get started. So there are metabolic conditions. And so when you think of metabolic conditions, you might right away think about diabetes. Now, metabolic conditions are a group of conditions characterized by abnormal chemical reactions and disruptions in our body's metabolism. So, yes, type 1 diabetes as well as type 2 diabetes, there are differences there. I won't go into that at this moment, but they are sort of the recognizable ones that are metabolic, but also ones related to our cholesterol. So, things called dyslipidemia. We also know under the umbrella of metabolic health conditions, obesity lives there as well as metabolic syndrome. Metabolic syndrome is a grouping of different health conditions. And again, this is a real overhead today or an umbrella approach to conditions. We're not going to dive in as deep. So, metabolic conditions are definitely influenced by our physical activity and exercise levels. Next, looking at the cardiovascular diseases. And so these ones, as you can imagine, are the ones that are with the heart. But we also have to remember that the heart functions with our blood vessels as well. So, issues with cardiovascular conditions are usually with blood flow, heart rhythm, other structural abnormalities that all affect how our heart and our vascular system work. So, the first one that you might think about, and many people deal with, is hypertension, and that is elevated blood pressure. We also have conditions like coronary artery disease, peripheral artery disease, and stroke, which are all related to our physical activity level. So, from a prevention perspective, but also to help manage those conditions, physical activity and exercise can have a great, great impact. The next one is the pulmonary diseases. So you can imagine the air that flows into your lungs and the air that flows out are all related to your pulmonary system. So these are all the conditions that are affected by the respiratory system, primarily the lungs, and this all affects our ability to breathe. So in terms of these conditions, you can imagine that asthma might be top of mind. Yes, we can exercise when we have asthma. It's not so much that it can prevent asthma, but it's more about how do we exercise to help our asthma and the exacerbations of challenges with breathing. We also know its influence on chronic obstructive pulmonary disease, the way that the exercise allows us to build the function of our lungs when it's maybe been hampered via these conditions. We also know its role in cystic fibrosis, as well as with sleep apnea. And sleep apnea could be around a prevention model, but also a management as well. Moving on now into the osteoarticular diseases. And so this would relate all to our bones and our joints, and it can be a whole host of different conditions because it's also related to the structures that are around our bones and joints. So that could also be related to your musculoskeletal system, that can limit your movement. So top of mind might be osteoarthritis or maybe arthritis in general. We also have rheumatoid arthritis, which is an autoimmune disease that also affects the joints when our body believes there's something wrong and breaks down the joint structures. We also have osteoporosis, which is the thinning of our bones, as well as a fibromyalgia, which is a source of the specific spots in our body that present with pain. So osteoarticular diseases could really show up as pain. And we know that exercise and physical activity can help us prevent pain, but it can also help manage our persistent pain as well. So really a large area of research in these conditions. Cancer, quite a broad term. We know that there are a variety of different types of cancers that can occur in the body. And so cancers are characterized as uncontrolled growth and spread of abnormal cells. And this threatens the organs and the organ systems in our body, and then they are no longer functioning as well as they could be. And so, what we know from research is that colon and breast have quite a bit of evidence around prevention. We can help prevent these cancers from occurring by being physically active and exercising. There's also growing evidence around bladder and kidney as well. Now, these are just 4 different types of cancers. And as I said, there are a lot of types of cancers. So, we also know that it's quite beneficial for people who are on the cancer journey that there is value in them being physically active to help with fatigue, to help with managing stress and mood, all of these things when we are experiencing cancer. So again, not an exhaustive list here, but we know its influence on cancer from a prevention and management perspective. Our mental health. So this, as you can imagine, is becoming more and more talked about. And I put it in this presentation simply because we know the influence of our mental health on our physical health as well. And so this is a really broad spectrum of different disorders that can affect emotions, our psychological well-being, as well as how we act and our behaviors. And so the most common that you're quite well aware of are depression and or anxiety. They are different things, but physical activity and exercise can have a huge impact in helping manage those mental health concerns. We also know that postpartum depression is also really well supported with exercise as being one of the tools to help women after having children, as well as sleep disorders and insomnia. So that is, again, not an exhaustive list here for our mental health conditions. However, these are kind of a major prominent ones that exercise can help with and potentially even prevent from occurring. Gastrointestinal diseases. And so these would be ones, as you can imagine, in all of these organs, including our esophagus, our stomach, intestines, liver, gallbladder, and pancreas. And these things can all lead to digestive discomforts and disruptions. So there is growing evidence around irritable bowel syndrome and how exercise can play a role in help managing the symptom of bloating. We also know physical activity has a huge impact on our bowel health and how well our bowel functions to evacuate our fecal material. So for constipation, physical activity is such an important tool. We also know its impact in the non-alcohol fatty liver disease. We know it helps manage and keep our numbers in check, as well as it might actually help prevent gallstones as well. So there is a role for exercise and physical activity for our gastrointestinal. And then last but not least is our neuromuscular diseases. So this is the connection between our nervous system and our muscular system. When there is a breakdown, when that system no longer functions well, we can have disorders that are affecting muscle function, movement, coordination. So some examples of these conditions would be multiple sclerosis, Parkinson's disease, cerebral palsy, and spinal cord injuries. And again, this is not an exhaustive list. However, we know that physical activity and exercise can be extremely helpful for individuals with these conditions in terms of their function, their coordination, their control, their ability to move and have mobility. So physical activity and exercise play a huge role in neuromuscular conditions as well. So, holy guacamole, did we cover a lot of health conditions and very briefly as well? I didn't go into much detail. However, the idea here is that physical activity is a key component to chronic disease prevention and management. And we know that physical activity and exercise has such a positive role to play in all of these disease processes. So it's no secret anymore. And I thought it was so important to get this video out because it is making the public more aware, making you more aware about how there can be such great impact of physical activity and exercise on your health. Now, of course, each individual with a chronic disease or multiple chronic diseases is unique. And so, what that requires is a customized exercise prescription. This is not a one size fits all approach. Each individual is going to be coping and dealing and having different levels of the disease states. So, it's very important that you have a qualified exercise professional working with you to help you really tailor the approach and how your exercise and physical activity can be used to keep you as healthy as you can and improve the quality of your life. And so, with all of that said, we can't go anywhere without having a little insight into action. So, my question for you today is, what types of exercise or physical activities best suit your current fitness level and health? And how could that help prevent and manage any chronic diseases that you have? So go ahead, ponder that question, maybe write it down in a notebook or journal. Start to think about what it is that you could do to help prevent chronic disease, as well as help manage any chronic diseases that you have so far. And of course, I'm all about sharing free things, so you can jump on and get my free mini online course. It helps you assess. It's all about assessment. So it's assess as one savvy step to accelerate your physical activity behavior change. If you're struggling, you got to know where you are. And so this is a great tool and mini course that you can take to determine how physically active you currently are. And of course, I am always here. I'd be happy to support you along in your physical activity journey. So drop me a comment below if you have any questions, comments about how this works maybe in your life, how you can help prevent certain chronic diseases, or maybe if you're dealing with one, what would be some recommendations. And of course, I would always love to work with you one-on-one to really tailor and customize a program that suits your needs. Thank you so much for joining me here and staying right up to the end, going through all of those different chronic health conditions and really the role that physical activity and exercise can play to really give you the best life that you can have. Okay, thank you so much for joining me. We'll see you again. Bye.